Hello everyone and welcome back. So we have started the preparation for obstetric subject and in the previous video we have discussed the perpurum and perpural pyrexia and episiotomy. Now in this video we are going to discuss the perineal trauma or tears and instrumental vaginal delivery and vacuum. Okay, so starting from the first topic of today's video, that is perineal trauma or tears. So a type of question that is asked in the exams is that there is a PG delivered at home with third degree perineal tear. Then types of perineal tear and what are the complications and what is the third degree of perineal tear and what is the management for perineal tear. Okay, so perineal tear first degree trauma or tear corresponds to lacerations of skin or vaginal epithelial mucosa. This is first degree tear when there is the lacerations of the skin or vaginal epithelial mucosa. Then second degree tear, it involves perineal muscles, vaginal mucosa and perineal skin. The third degree perineal tear involve injury to the anal sphincters and which is extended into the rectal mucosa, and the fourth degree is the involvement of the rectal mucosa. Now the risk of the perineal tears and increased risk of perineal trauma is associated with larger infants, instrumental delivery, multiparity and malposition. These are the risk factors for the perineal tears or trauma. Now, how we will repair the perineal tears? There is a question that a primary pair are delivered with forceps delivery with the third degree perineal tear, define perineal tear, and the complications of perineal tear. Here is a question that there is a 25-year-old delivered with output forceps. On examination, she is diagnosed to have third degree perineal tear. So define the third degree perineal tear. Okay, so perineal repair, we have defined the third and second degree, that the third degree involving injury to the anal sphincter and extended to the rectal mucosa. Now coming towards the perineal repair, the following Okay, the following is recommended for perineal repair. For first and second degree perineal repairs, ensure adequate analgesia, that is epidural and local anesthesia. Then place a pad high in the vagina to prevent blood from the uterus from obscuring the view. Then check the extent of the cuts and lacerations. Then first repair the vaginal mucosa using rapidly absorbed sutures, maternal on a large round body needles, and start at the apex of the cut or tear and use a continuous stitch close to the vaginal mucosa. Interrupted sutures are the place to close the muscles layer and closure of the skin follows. Interrupted sutures can be used, however, a continuous subcuticular suture procedure more comfortable results. Then perform a genital vaginal examination to check for any missed tear or inappropriate position of the anatomy, and remove the pad which was placed at the vagina and check that no swabs are left in the vagina. Finally, put a finger in the rectum to check that no sutures have passed into rectal mucosa and that sphincter is intact. If sutures are felt in rectum, they must be removed and replaced. Okay, so we have studied the perineal repair for first and second degree. That is, ensure adequate analgesia, then place a pad high in the vagina to prevent blood from the uterus, then check the extent of the cuts and laceration. First, repair the vaginal mucosa using rapidly absorbed sutures and maternal on a large round body needle, and start at the apex of cut or tear. Interrupted sutures are the place to close the muscle layers, and the closure of the skin follows interrupted sutures. Page number 1 second. Okay. So this was all about the first and second degree perineal tears repair. Now the repair of the third and fourth degree tear. So it should be performed by trained practitioner, and there must be adequate analgesia, either inguinal or general anesthesia, as a local infiltration does not allow relaxation of the sphincters enough to allow such satisfactory repair. Then good lighting and assistant is needed. The repair of the rectal mucosa first by polyglycotic acid suture material, then interrupted sutures with nod towards the mucosa by overlapping margins of torn sphincters or by appropriately the margins. Then post-operative care, that is prophylactic antibiotics should be given to prevent infections, analgesics, laxatives for softening of the tools, and physiotherapy. So this was all about the perineal tears. First, we have to identify that what degree tear it is. It is first degree, second degree, third degree, and then we have discussed the risk of the perineal tears, and then we have discussed the repair for the perineal tears. The repair is provided on the basis of the degree, that is first, second, third, and fourth degree. Now coming towards the second topic, that is instrumental vaginal delivery. So the exams, the questions that are commonly asked in the exams are that there is a PG presents to labor room with prolonged labor. After after examination, you plan immediate delivery. So what are the indications of instrumental delivery and what are the prerequisites for forceps delivery? Prerequisite for forceps delivery and complications of forceps delivery, IVD forceps delivery. Okay, so we have to learn in basic that what are the needs for the instrumental delivery and what are the complications. So instrumental delivery, the delivery of a baby vaginally using an instrument for assistance is called instrumental vaginal delivery. And the types of the instruments used are obstetrical forceps and vacuum extractions. The obstetrical forceps are outlet forceps, which is called Wrigley's, and mid-cavity forceps, which are Simpson's forceps, and the rotational forceps, which are Key-Lunk. Okay, now indications of instrumental delivery are fetal and maternal. The fetal are malposition of the head, that is occipito-transverse and occipito-posterior position, and fetal distress. And the maternal indications are maternal distress, prolonged second stage of labor, and to shorten the second stage of labor in certain diseases like hypertension, eclampsia, CVS, respiratory, and CNS diseases. The contraindication are face or breech presentation in gestation less than 34 completed weeks before full dilatation of the cervix. Now, the forceps that are used are Keelan rotational forceps, Simpson's non-rotational forceps, and Wrigley's forceps. Prerequisite for the forceps deliveries. On abdominal examination, lie of the fetus longitudinal, assessment of the fetal size, uterine contraction must be present, urinary bladder must be empty. On pelvic examination, full dilatation of the cervix, ruptured fetal membrane, that is spontaneously or artificially. Presentation should be suitable for instrumental delivery. Outlet should be adequate. Cephalopelvic disproportion should be excluded. Complete engagement of the head and empty surrounding tissue, that is urinary bladder. The complications are fetal, which are fracture of the cranium, intracranial trauma and hemorrhage, cephalohematoma, and facial nerve palsy. The maternal complications are trauma, that is lower genital tract, vulva, vaginal extension of the episiotomy, and third degree perineal tears. Upper genital tract, that is cervix lateral tear, may be extended to the lower uterine segment involving uterine. Urinary bladder, that is urinary bladder damage, urinary retention and infection, hemorrhage, sepsis, UTI, and fistula formation. These are all the prerequisites of the forceps delivery. Okay, so we have discussed up till now the instrumental vaginal delivery, that it is a delivery of baby vaginally using an instrument for assistance is called instrumental vaginal delivery. Now the types of vaginal forceps delivery are obstetrical forceps and vacuum extractions. The indications are fetal indications and maternal indications. These are the contraindications. Then the forceps that are used are Keelan rotational forceps, Simpson forceps, and Wrigley's forceps. Then these are the prerequisites for forceps delivery on abdominal examination, on pelvic examination, and the complications are both fetal and maternal. In maternal, the trauma may occur in lower genital tract, in upper genital tract, and urinary bladder. Now coming towards next topic, that is vacuum. So we are having a question that what are the prerequisite indications, contraindications, and complications of vacuum delivery? Okay, metallic cup have good results over the plastic cup. Okay, vacuum is done through a cup, so the metallic cup is having good results over the plastic cup. Okay, so 4 centimeter size is used when cervix is not fully dilated, and 5 centimeter size is used when head position is occipito-posterior. Now, the indications of vacuum are that fetal distress or fetal compromise is present, retained sac and twin is present, and maternal distress in the first stage of labor is present. The contraindications are that gestational age is less than 34 weeks, and face and beach presentation, and cervix is not fully dilated, and bleeded from the fetal scalp is present. Now the mechanism of action is that rotation plus extraction of the baby is done, and it can apply on the occipito-transverse and occipito-posterior position. The rule is that pressure is created up to 0.8 kg per centimeter square, and traction must be in line of the pelvic axis. And application on must dependent part of the vertex, and delivery must be completed in 15 minutes of applying the instrument, not more than 2 attempts to apply the vacuum, and head should come out with vacuum, not only caput. Vacuum should not be followed by forceps. Now, the complications of vacuum are maternal, that is trauma, hemorrhage, trauma to genital tract when applied to the undilated cervix. The fetal are neonatal jaundice, that is hyperbilirubinemia, cephalohematoma, intracranial hemorrhage. Then the causes of failure of vacuum are wrong selecting of the cup, difficulty application, traction in wrong direction, head in is high, contracted outlet, and if applied on large caput. So we have discussed about the vacuum. Then a metallic cup is better than the plastic cup. Then we have discussed the indications of vacuum, the contraindications of vacuum, the mechanism of actions, then the rule, and then the complications of the vacuum, which are maternal complications and fetal complications, and then the causes of the failure of the vacuum. In the next video, we will discuss about the C-section, and then we will discuss the specific topics in the pregnancy obstetric, which is the anemia in pregnancy, and folate deficiency anemia, and hypertension disorders in the pregnancy, and then the eclampsia and gestational diabetes. Okay, so then we will discuss the we have discussed up to all the procedures of the delivery, that is vacuum, etc. Now in the 4 topics are remaining, which are the main topics from obstetric, that is the C-section in obstetrics. Then we will discuss the anemia in pregnancy, the diabetes mellitus in pregnancy, and the hypertension in pregnancy, and then we will cover the op subject. So don't forget to like this video and subscribe my channel for such videos. Thanks for watching.